Welcome to Slut in Training, hosted by Missy Greenberg,
Jordan Carlson,
Tania Ross.
Hello, sluts. Hello.
Welcome, sluts. Welcome, sluts. I am
Red.
so thrilled to share my word of the episode with you today.
Let's do it.
Okay. Well, it's the dirty waffle.
ew. So, okay, right off the bat, it makes me think of Blue Waffle, which is a Cards Against Humanity card. Maybe now Cards Against Humanity can like sponsor us or something. But that is equally as
against
gross.
sluts in training.
I feel like it might not be off-brand for them.
It might not. No.
So, okay, it's not blue, but
not
it is
blue.
dirty. So does it have to do with your
crunchy?
Ass? Ooh, it's crunchy?
Well,
Is it
waffles are crunchy, like crunchy on the outside, soft on the inside.
your crunchy asshole?
I'm
Put
not
it
sure if it's
We're going to leave the
crunchy, but
asshole part.
it could get crunchy if you leave it in for too long.
Oh, no.
Oh, God.
Okay, so it is not your
All
butthole.
right. Well, why don't we jump into the real definition?
Yeah, okay.
Okay,
Because
here it is.
people want to know.
Here it is, sluts.
Dirty waffle.
The dirty waffle is a sex act in which the male ejaculates
voice is
into
really
one of his hands and then spreads it into both hands, known as preparing the batter, and then proceeds to slap the female partner on both ears with both his hands, simultaneously launching the male partner's batter into the woman's eardrum.
So gross.
Ew.
Okay,
Was that an audition that you just did? Because
Why,
I
thank you.
feel Like we were just
Stop it.
we were
your
just
voiceover audition?
Yeah.
Basically, he's doing this, right? And into the ears.
Well, let's get on to our guest, which is way more important than dirty waffles.
Okay, Dr. Michael Lee is a board-certified plastic surgeon with over 20 years of experience specializing in aesthetic surgery. He is also an assistant professor of surgery at Northwestern University, where he integrates his clinical expertise with a dedication to medical education and research. Wow. Welcome.
Welcome, Dr.
Welcome.
Lee. Oh my gosh.
Thank you for having me.
Yeah.
Thank you for coming. That was an impressive intro.
Yeah.
And so professional. This is the unprofessional intro. Dr. Lee did my boobs and my tummy tuck back during COVID. So we have formed a special bond and friendship because I probably annoy the shit out of him every time I come into the office.
No.
Can we
But
see
the girls know who I am.
Can we see it?
Tonight. Yeah, for sure.
okay.
Tonight. Sorry, Dr. Lee.
I'm looking forward to it.
We ask all our guests to define or tell us what slut means to you.
Well, I haven't said the word or heard it in a while, but definitely in high school and college, I think it kind of meant a woman, typically, who slept with a lot of guys. And I think it was, at the time, meant to be derogatory, but I definitely get a sense now it's like more empowering or a badge, that women tend to be proud of.
Did you say a bitch?
Badge.
Oh, I was like, geez, Dr. Lee.
It's a bitch.
Badge.
It's a
like,
bitch.
I like that one too.
I like that one. Yeah.
I like being a bitch.
Okay.
Yeah.
Yeah.
So, it's changed over the years. But I can't say that I say it too often.
Yeah. Well, you are a slut in training for us.
Yes.
Yes.
Yes, welcome.
So welcome.
We
Welcome
say
to the club.
Very frequently
Yeah.
here.
And yes, and men can be considered sluts in training for sure. Yeah.
Oh yeah. And we'd love a plastic surgeon, in
the club.
in our club.
In our inner circle of slutdom.
Yeah.
Dr. Lee, how long have you been a plastic surgeon and what made you choose this profession?
Yeah, I've been a plastic surgeon for 21 years and never thought I would go into plastic surgery. I thought I was going to be a heart surgeon, did a lot of research in heart surgery. And then it was one of my last rotations, my last year of medical school. And the chief resident at the time was incredibly funny and smart, knowledgeable. And he kind of pointed out that we were operating on women and men and young people and older people. And he kind of pointed out if you were going to go into cardiac surgery, at the time, it was mostly 65-year-old white men, and you'd be doing the same operation over and over. And ever since he gave me that advice, it was kind of eye-opening for me. And
That's great advice. by
really
the way.
enjoyed it.
Yeah.
So your
really enjoyed
demographic
it.
is
Everyone.
Everyone. Every age, every person, men, women, all kinds of people, right?
Variety.
Yeah.
So, like in the last month of operating someone who's 15 or 16, all the way to, I just saw a woman leave today who's getting a facelift who's 80. So
That'll be me. Yeah.
Well, what do you do at
Keep
15?
your hands warm until like I turn 80. Like keep them working.
yeah, yeah.
So Dr. Lee, obviously you've seen me, but I think you have a natural aesthetic. Like how did you come to decide what your aesthetic looks like as far as being a surgeon?
Yeah, I mean, I think it has to do a little bit about like what my general aesthetic is overall, whether I'm in plastic surgery or not. And it tends to be a more conservative within some general bounds of nature and in terms of a look. So I don't tend to do looks that tend to look very surgical or post-surgical. And I think that's pretty consistent with the Midwest area, obviously versus LA and Miami, which tend to be a little bit more on the extremes. But, my job is really to kind of be a consultant for people. So when they come in, to find out what they're looking for, to kind of tell them and give them advice, what I think would look good for them, to give them some options and kind of discuss with them the possibilities of what we really can do. I think social media does kind of distort that a little bit because, a lot of that is curated with like apps and stuff. And so we want to make sure that they have a realistic expectation of what we can accomplish.
Yeah.
So.
How do you kind of navigate that as far as what they're looking for? Or they'll show you a picture of, I want to look like her. And she I'm Asian and she happens to be fucking white as, like white as can be and looks like Barbie. And how do you manage that expectation? Or do you discourage kind of that? Have there been unhappy patients?
Do you ever say no?
Don't like your answer?
Yeah, do you ever say no?
Certainly we do talk about that where I tell them, like you said, the person who's Asian and wants a completely Caucasian looking nose, and we kind of go over what, if it's even possible, right? And so we kind of go over what's likely, what's possible. The biggest thing that I see is someone with, and this is something that one of my mentors told me, someone who comes in with a size 10 nose, a giant nose. We can only make it so small.
Yeah.
You're not going to make a nose like that look like Natalie Portman or Florence Pugh and be a little button nose.
Yeah.
You make a size 10 nose, a size 7, but you're not going to be able to make it a size 3. And so that's one of the early discussions I have because at the end of the day, the thing that gives me gratification with the person is really them being happy after surgery. And to be happy, you have to have like an expectation that we both kind of have, right? So if her expectation's here and mine's here, then she's going to be very unhappy. So part of that is the discussion and the consultation. And I do turn people away. I do.
Yeah, he does. I
have people like that want facelifts that are 32 or, so you have all kinds of, or people with obvious psychological problems. And, we have to kind of enlist therapists to make sure that they're...
You can read the signs pretty quickly if they have some other underlying issues.
Yeah, sometimes you can. We have different kind of, what are they called? Not pseudonyms, but acronyms to kind of point out when somebody is going to have some form of body dysmorphia, which is one of the real problems. Where they're seeing something that nobody else can see. And that usually is expressed by when they talk about a giant bump on their nose when you barely see anything. And then you kind of already look predisposed to look to see if they're not a candidate. And so those things, I kind of lean in on saying, my job is to make you as happy as you can be and feel as good about yourself as possible. But I don't feel like I can deliver that for you because it seems like blah, blah, blah. So I do have those discussions and, but, that's part of it. And that's rewarding too, as well as surgery.
So I passed Dr. Lee's litmus test for
yes, you did.
patient. Low risk, sane patient. She's not going to see laughter.
Good job, Missy. You no longer need therapy because Dr. Lee has said that you are healthy.
Yes, I am fine.
You're fine. Psychologically, you're fine.
I just wanted my boobs back before I had kids. I was like, don't give me double D's. I just want my boobs back.
Oh, it's perfect.
Yeah.
They are very nice. You did a good job.
They have seen them. So
Yes.
they have seen your
Oh,
work.
thank you.
They look great. There are stigmas that are, exist around plastic surgery. And I was wondering if you could kind of talk about those.
Yeah. Yeah, I think so. And I think that there's a couple different examples. So one, I think certain ethnicities are definitely haven't jumped on the bandwagon that a lot of people have, where plastic surgery has become more acceptable. People are more open to telling people they had it done. And so I have different ethnicities that are like, I really don't want anyone to know. And so they kind of live where they're kind of hiding that they did surgery. They don't tell their family. They don't want anyone to know. So I think that's kind of interesting, and different cultures that it's still a little bit more hidden. Obviously in America, typically Caucasians, obviously Brazilians and South Americans, this is,
Love
Koreans.
Brazilians.
Koreans, it's like everyone gets it.
Everyone gets it.
But in some cultures not. And so you get that. And the other thing is, I think there's still a bunch of people of the older generation where, especially a husband and wife, oftentimes, and it does not always have to be this way. I certainly see the reverse, but oftentimes a woman is very unhappy with how they're aging. Their husband, of course, says, you look great and you look wonderful, which you want them to say. And then they don't want them to undergo any risks or the costs or recovery related to surgery. And so it makes the recovery a lot harder. So there's a little of that. And, I think it's getting better from that standpoint, because people have become, like Missy, much more open about saying that they had surgery. And I think I had 2 people today, and they were definitely like, I'll go back to work. I don't care if anyone knows that I did a facelift or, breast. Or I think the face is a little bit more stigmatized than the body. Everyone seems to be fine with doing some body work, but the face, but like I said, more and more women have been open. I think, again, men also as well. So men are a little bit more secretive about getting Botox and facelifts, and
but they do.
They do. I did one in the last 2 weeks. This guy. So, but it's changing, and I think in the next 10 years, especially as more and more people get it, that it will be more accepted. I think the biggest thing that social media has done as well is, I don't think people have been interested in the way they look and attracting people with the way they look since the beginning of time. But I think the biggest thing that social media has done is it has changed the population of people that are interested in it. But you have younger people that are now more attuned to surgery. And my daughter, who's 18, she knows friends of hers that have had surgery. Unfortunately, some that I've actually even operated on. And now it's been more accessible to different socioeconomic status. So I think as that happens, it becomes less stigmatized.
Yeah.
Dr. Lee, is there a procedure that someone can do to boost up their confidence that you would recommend? No questions asked, just something that you think would boost up their confidence. Is there?
It's hard to limit it to one. I think people are so different, and at obviously different age. People age differently. Sometimes it's something you're just, you've been self-conscious about since you were young. But I can tell you overall, when you look at the most common plastic surgery procedures that are done, the 2 that are at the top of the list are breast augmentation and rhinoplasty, right?
Right.
So when you think of somebody who is flat-chested and they feel like being sexual or being a woman feels like they have to have some breast tissue, then for them, it really is a big jump in their self-confidence. Or for some women, like I was alluding to, these young women that I've done surgery on that are very young, they happen to have congenital problems. So then one breast is developed and one breast is not developed. You can imagine entering their kind of sexual
Didn't even
journey
think about
that they feel very self-conscious about that. So, and rhinoplasty, when the nose is way out of whack, what most people's nose, a giant hump, or the nose is really turned down. And so those two things make a big difference. But overall, I wish I could tell you everyone would benefit from one thing, but it varies to what really, I think, confidence, comes from obviously feeling good about yourself. And so everyone's a little insecure about something different, right?
Yeah.
And so
and you
if you
see
can
all
address,
those.
so if you can address the thing that makes them feel, can make them feel more confident and more, then that brings everything else. If you're confident, your sexuality's better.
You're better in bed.
You have a better, you attract more people.
Dr. Lee just went right over that statement.
Oh, I didn't hear you. Sorry, what did you say, Missy?
When you have more confidence, you're better in bed. But I thought you heard me and you just kind of rode right over that statement.
I chose not to answer that one, but I mean,
no comment.
Did we just have a slutty moment?
We had a slutty moment.
So did.
but obviously,
Yeah.
I would think that that's true too.
Yeah.
I would think, insecurity is probably not a great thing for being a slut.
Yeah.
I would imagine.
Yeah. You have to be a confident
You have to be
slut. That's part of the
confident
training.
slut.
Yes.
Yeah. That's
One
part
of
of the
It
training.
comes with training, yeah.
So Dr. Lee, what are the most, you kind of tapped into it, the most popular procedures that men and women kind of come to you for? And going off of that is, what does your demographic look like? Do you tend to see more people who are single, who are married, who are divorced or getting divorced, or even postpartum like me when I was really unhappy with my body?
Yeah. I would probably say the biggest population is probably like that 35 to 55-year-old woman. I see men, I see straight men, gay men, but the largest population is probably 35 to 55. And you can imagine in that range, there's all the things that you mentioned. A lot of them are married and they've had kids and they just felt like
their souls
their
were
body's
sucked out of their
destroyed.
body.
Yes.
Yeah.
And so it's along the same lines.
that.
You just want to regain that confidence
Yeah.
but then you have people that are going through divorce and unfortunately people whose spouses pass away. And so I do see that as well.
Is there a surgery that you tend to see for men specifically, and what I guess age does that fall into?
Yeah, I would say the most common thing for men probably, I do a lot of eyelids, so it's probably upper eyelid because obviously a lot of men get the heavy droopy upper eyelids. I see men, the other thing is they start to age to get, more boobs, bigger boobs. So I see gynecomastia, which is liposuction of the chest.
Oh, interesting.
Very common in your 40s and 50s, and they start feeling
Do
self-conscious.
they get tummy tucks too, guys?
Some do, because, with Ozempic or just overall weight loss, people lose a lot of weight and so there's extra skin. And then I see, so like gynecomastia or the surgery on the chest, eyelid surgery and facelifts are probably more what I see from men. I see obviously a lot of people for Botox fillers and some lasers, and then that crowd is pretty varied.
Yeah.
I certainly see a lot of women that are in their 20s, but I don't see them as much. Whether they're doing like preventative Botox or they get a breast augmentation or rhinoplasty, and they're oftentimes women of daughters of the patients that I do have too as well. So.
Interesting.
That makes sense.
What is your favorite procedure to do?
Good question.
That's a good one. Actually, honestly, my favorite is really
Because you do it all.
Yeah. My favorite. I love eyelid surgery. I love facelift surgeries because they're meticulous, they're difficult, and they're very customized. They're bespoke to the person. So those, I like it from that aspect, but really what makes me feel best about it is when I can really make someone feel really good about the way they look afterwards. They can
I love
feel
that.
like they, like you said, that confidence and just the happiness. Occasionally I get tears and that's always nice.
You didn't cry when
You're
you did my
sensitive.
boobs.
I don't
Yeah.
think
No, you didn't. I'm talking about the patient. You didn't cry. You should have cried.
You didn't cry when you did my boobs.
he cries with them,
You
Missy.
cry?
So
No.
you have to cry
He's
first.
got great bedside manner. I told these ladies, I was like,
Yes, yes.
he's great.
If he's
But
crying
if you're crying with them, that's the next level of
I
bedside
know.
manner.
Yeah,
Dr. Lee.
An extra.
Yeah.
Ooh, okay. Well, on a scale of 1 to, oh my God, why did you do that thing? How weird are some of the surgeries you've been asked to perform?
Ooh, that's a good question.
Over the years, I've gotten some weird ones. I'm trying to think. I did. Speaking of your Asian, the white, I remember this one Asian
I
guy.
didn't say I wanted to be white.
No, I'm just saying that example.
I
There
know.
was this guy. I still remember him, and it was probably 17 years ago, 15 years ago.
Mm.
He comes in and picture this guy. I think he's got a little bit of a Fu Manchu thing going. It's kind of wispy Fu Manchu thing.
Mhm.
And he's got long hair, but he's balding on top. So it's like wispy on the top and this long
Yeah.
flyaway kind of hair,
Uh-huh.
Fu Manchu.
Yeah.
And he comes in and he wants a nose job. And he was probably 40 something at the time, but look 50, 40 something, look 50.
Mhm.
And he's like, I want my nose, I want it to look like Nicolas Cage. And I mean,
That's
I don't know, like
specific.
his nose is long, he has a bump on it.
Yeah.
But he had several pictures of Nicolas Cage, and he's like, I want to look like Nicolas Cage. And
What did you tell him?
Yeah.
I said, it was very hard for me not to laugh because, the guy,
Oh,
Was he
gosh.
Asian?
they were
He was
literally
Asian?
like,
Oh.
pardon me?
He wasn't Asian. He was Asian?
This guy was Asian.
Okay.
So like he's
Tried to
like a
look like a
Chinese
white
guy,
guy. Yeah.
with a Fu Manchu and bald
Uh-uh.
and a little chubby.
Uh-huh.
And there's no way.
There's no way you could get that.
There's no way he's going to look like Nicolas Cage.
Yeah.
So
How did
and
he make
there's no way I would
that
make that nose because I don't think Nicolas Cage has a great nose.
No.
Yeah, you would
No,
have to
no one's
add a
talking
bone,
about-
right?
Yeah.
Well, no one's
So-
talking about Nicolas Cage's fucking nose. No one.
No.
Yeah. His nose. So, but we did use his rib and we created a much better nose for him. And it's a much more Roman looking nose. But, and I think he was happy, but that was super weird. I think the weirdest things though are really related to like cosmetic vaginal surgery.
Oh,
Like,
All right, hold on, Dr. Lee. You're tapping to my next question.
Ooh.
Well-
The only reason, I'm just kidding.
Yeah.
The only reason we have you on here is to talk about how do we improve one's sex life in the bedroom. Any procedures that women or men come to. Obviously, it's like, is it vaginoplasty? I had to Google this shit.
Vaginoplasty?
Yeah,
Is that
so the
what it's
labial
called?
plasty. So
Thank
there's-
you, labia.
Labioplasty.
No.
That makes more sense. Vaginoplasty just sounds like a
Vaginoplasty?
generalization of.
So
Your vagina.
I will,
Yes.
yes. So I will tell you this. So as you ladies know, being sluts in training,
We
there
are.
Yes.
several parts
See?
to the vaginal area.
I love Dr.
Okay.
Yeah.
There's the outer lips, which are
Yeah.
like the puffy area.
That's the
There's
two
the
lips. Mhm.
That's the inner area called the labia minora. There's the obviously clitoris with the clitoral hood, and then there's the entry or the opening.
Mhm.
So all those areas can be operated on.
Okay.
Okay.
Now, for me, I don't really do much of that surgery. I will do what's called a labioplasty. That's where the inner lips are too long, or one's really short and one's really long.
Mhm.
And so I do those. I did one a long time ago. This is just like not my type of surgery. And so, but this was a young woman who wanted her nose done. She was very self-conscious that one of the lips, she was probably like 21 or 20. One was so much longer than the other, like 3 times longer.
Oh, wow.
And so I did the surgery and she was happy with her nose. She was like thrilled with the labioplasty. So I'm like, oh, I can see, I guess if you're really self-conscious and they look,
Uneven.
really out of whack.
Oh, I can. Yeah,
And
I can
so
understand.
I actually just did someone that was 65 last week. Well, again, it's not something I do often, but occasionally, you
Wow.
get that. But
Yeah.
so that's one, and I totally get it.
I'm just-
And it really makes them feel comfortable. And
Yeah.
I totally get it. I do that surgery. The other ones are the weirder ones, like where they're trying to create a hymen again, like
What?
be like a virgin,
Oh, no.
yes.
or to
That
make the
is-
opening, the internal opening,
Tighter.
like
Or they
tighter.
tighten it.
Uh-huh.
I've
Right, because
heard
I
of
mean,
this.
you've got babies coming out of that
Yeah.
tiny little hole. I don't.
Yep.
I don't.
So what do
I
you do?
didn't-
Sew it?
I don't do any of that stuff.
Oh,
So
No.
Oh, okay.
But there are different things. They usually use a laser or they use this M-Sculpt type of machine, which tightens
Oh,
like
contracts.
it's like
with
Kegel,
muscle.
like a major
Yeah.
Kegel.
Oh,
Yeah,
okay.
And so there are ways to make the opening a little bit
Surgical
but-
Kegels.
That's a little beyond my
That's not where you go.
No.
yeah.
Is
So I
that-
stay above here. I do
you
the
don't go
face.
far south.
No,
Oh my
but those are weird.
Actually, stays in the Midwest.
Stays in the Midwest. You got to come out to
Get out
LA
to
for
Canada.
that stuff.
The 50.
Yeah. So, but that's, but again, it's the one nice thing about it for me has been like, speaking of the 65-year-old that had it done, this would probably be apropos for your talk about sex life and stuff. She's a 65-year-old woman, been single most of her life. And she happened to have an encounter with a man. She's telling me this. She comes in and says, I had a consultation for a clitoral reduction. And I'm like, I don't
What?
do that
Yeah.
surgery. And why would you want to reduce it
Who
anyways?
booked this appointment?
What?
So anyway, yeah, exactly. That's what it was. And then when I said, well, you're here, let's take a look. And she's pointing to it. And I go, that is not your clitoris. So one, she's 65 and obviously this is what her clitoris is. It was her labia.
Yeah.
And one was really long and one was really short. Same kind of thing. And she had not been sexually active, but had this encounter. And this guy was kind of a jerk and just said,
Oh.
one's
that's
not
terrible.
normal here. And so it brought her in, and I was of course, a little righteously upset. I go, you're 65. If you're coming in just to do this because one guy said this, then I don't think you should do it.
Fuck him. Literally.
Yeah,
Not
that's
fuck
what I
him,
said.
fuck him.
She's like,
Yeah, no, he doesn't deserve that.
you're right. And so
Yeah.
I told her this and sent her away. And she's like, well, it hurts me. And one was very long versus the other one. And she's like, it hurts me when I ride a bike. It hurts me to sit sometimes.
Aw.
Oh, yeah.
And so maybe I'd like to do it. I know it's not for the guy, blah, blah, blah. So eventually I ended up doing it. And of course, she's very happy. But it's a little sad because when she's finished, it looks great. She's happy. It's symmetric. But she made a comment, which kind of made me a little sad. She's kind of like, so like if this guy and this opportunity ever comes up again, then it will be like much better. And he won't be like, no.
Oh.
Or
yeah.
she'll be able to tell
Dude,
him.
that sucks.
Yeah.
Fuck
She's
off.
gonna
Find
be-
a different guy.
Go
She's
fuck
still in
off.
training.
Find a different guy. I felt bad, but
There are plenty of other
Yeah,
guys.
Yeah.
find another guy, or find a guy that knows where your clit is.
Or be like, look what you're going to be missing,
He was
bitch.
probably like blind anyway. Couldn't fucking see anything. So
He was like,
So,
I
yeah.
just.
yeah.
Anyway,
So you-
but obviously that there's a crossover sometimes with sexuality, but it all stems from confidence for sure.
Wait, Dr. Lee, I want to go back to my question about sex life
Mhm.
because it's important.
It's very important.
We're sluts. You answered the female surgeries, but what about the men? What are they
Yeah,
coming to see you
yeah.
for to improve, enhance their sex life?
Yeah.
It's the same. I mean, it's the same thing. It's always about confidence.
Mm-hmm.
So for some men, if it's an older guy and he's got like the turkey gobbler, he's not going to feel confident, or the baggy eye. So I see a lot of men with the puffy eyes, the baggy
Yeah.
lower eyelids. And so they're not going to be confident.
Yeah.
I don't really do like
You don't go south?
genital work or anything like that. So there are guys that do like penis enlargement or fat grafting.
Mhm.
My understanding from my urologic friend here, one of the colleagues at Northwestern, is that actually if you want to lengthen your penis, there are like traction devices and they actually do work.
That's
You can
crazy.
actually
What is the
lengthen it.
traction device?
Isn't that like the
Like a
vacuum
pump?
thing or
Yeah.
something?
Maybe it's a vacuum. I don't know.
No,
'cause I
you're
don't
right.
do
It's
that.
traction.
Yeah.
Like as
It's
if I know.
something, but he kind of mentioned,
It
hey,
works.
it works and you can do that kind of stuff. And,
Huh.
that's not, I don't see people for that. I
Yeah.
said, my
You-
population is 35 to 55-year-old.
You stay above
Women
the pubic
typically.
bone.
Yeah, I try to. Maybe some liposuction on the legs. But that's,
Yeah.
that's about it.
Okay.
Would you do me the honor and use the word the dirty waffle in a sentence in the context of your work?
Ooh, that's difficult. Given our conversation, you got to go south for a second.
Yeah. Well, the woman who experienced a dirty waffle last night made my surgery facelift much more difficult. It was all sticky. And I couldn't sterilize her face.
Okay.
God.
Can I just say this was my favorite answer?
I think that was
Yes.
the winner.
And it was fast. It wasn't like we fed him this before the show.
Oh my God.
I'm quite
No,
impressed.
very
Yes.
quick
So
and
you-
ready.
Yeah.
That was so good. Okay.
So you lived up to your bio,
Yes.
Dr. Lee.
You did. That's the intellect that we were looking for. Okay, kind of along the same lines. What advice would you give to your younger self?
Yeah, I mean, I think whether it's work or your personal life, I think as we talked about, having that inner confidence goes a long way. Having low expectations, also like not low expectations, meaning like looking down on things, but just not having preconceived notions of things. To open your mind up to whether it's something related to work and what's going to happen, or a person you meet. I think
Or being on a
opens the
sex podcast.
possibility. Yeah, I think opens the possibility up for a much more fruitful and interesting life, you know, and probably a better professional life. You know, being willing also open to fail. As Asians, and Missy probably can relate to this a little bit.
I am
you
not
know,
type A.
Well, for me, it's like you didn't want to fail at things. But truthfully, if you don't fail at things, then you're not really trying hard enough, or you're not going outside your comfort zone. And so that has to do with both confidence and not having preconceived expectations.
We really appreciate your time, and I
it's fun.
especially appreciate your time after trying to get you on the show a little earlier. But if I have to show up for a Botox consult to get you on, I will. You are a wealth of knowledge, and I'm sure all our listeners will appreciate all the stories and kind of your perspective on plastic surgery, because it is, there is some stigma still in our culture.
Yeah.
At the end of the day, our show is about building confidence for yourself, and that empowers people.
Correct.
So how do our sluts find you? On social media?
Yeah, I mean, on social media, I'm Dr. Michael J. Lee. I think that's correct. And then
on Instagram?
Website. That's on Instagram.
Okay, that's your Instagram handle. Okay.
I think it's at, right? So
Yes,
now it's showing my age.
Really.
At Dr. Michael J.
Let the
Lee.
girls help you.
Yeah.
And then,
Put it in the show notes.
and then I have a website. And then,
And a lot of word of mouth in Chicago.
I mean, that's the nice thing. It's actually all word of mouth, which has really kind of been nice for me. So
Yeah.
Awesome.
It's a huge compliment to you that you're getting all these referrals.
Maybe we can bring him in person. He could do Botox on all of us.
Oh yeah, you should fly out to LA for sure.
Okay. Next time.
yeah, I've been meaning
time.
to try to get out to LA.
I've been trying to get you out here.
Mutual friend,
yeah.
and,
That would be an interesting.
Bring the Botox.
Yeah. Just bring your entire cosmetics.
Bring everything.
Surgery bag.
Yeah. Bring the knife.
surgery.
always with the idea of
Surgery.
doing 1 week, a month there, but it's far. It's a far trip for every.
Oh yeah.
That's what I do. You should come. Anyway, well, we really, really appreciate your time. I know it's valuable today. Sluts, thanks for listening. Follow, subscribe for more slutty moments. Sluts out.
Well, thanks for having me.